So I'm the nurse and I'm giving some discharge education to a patient that's just been diagnosed with leukemia, kind of what to expect, treatment options, and then some useful information just for the future going forward. So there are a couple of different kinds of treatment options that, depending on what type of leukemia you have, the progression and the stage that it is at will determine what type of treatment you'll have. There is stem cell transplantation, radiation therapy, chemotherapy, and targeted therapy. So I just give you kind of an idea of what's going on in the body. So this is a healthy blood and then leukemia. You see the big cells right here. These are the leukemia cells kind of taking over the healthy cells. A stem cell transplant can be used to restore healthy bone marrow in patients with leukemia. Stem cells help stimulate new bone marrow growth and restore the immune system. Chemotherapy, that's anti-cancer drugs made to slow or stop the growth of cancer cells. Chemotherapy can be given by mouth, into the vein, or into the fluid surrounding the brain and spinal cord. So here's most commonly what people see or think of when they think of a chemotherapy patient. She's here meeting with her oncologist, nurse, husband maybe, and you can see she has an IV running through her arm. So a port will be made, which a port's just kind of a fancy way to get easy access to get the chemotherapy into the body. You'll go to the hospital, sit there for a few hours, then you'll be all set, ready to go. Or again, it can be given by mouth. The induction phase uses a combination of drugs to destroy as many leukemia cells as possible and bring the blood count to normal. The second phase is used to destroy any remaining leukemia cells that may have been hiding during the first phase. Chemotherapy does destroy the bad cells, but it also destroys the good ones, especially those in the mouth, hair, GI tract, and bone marrow. A lot of times you do see patients who have just gone through chemotherapy. They don't have hair or they're awaiting a wig. It is a big lifestyle change. You're going to be going and sitting in chemotherapy for a few hours during the day. You're not going to be feeling great afterwards. You may feel very tired. It is a huge lifestyle change. But just know there are hundreds of different organizations and websites that are designed just for people that are going through this, and you can sit and speak to people that have gone through exactly what you're going through or will be going through as well. I've printed out a packet. It's leukemia support groups, community programs, education workshops, financial help. There's 11 pages here, and it's about pretty much everything you could think of. There are patients that have gone through it that have wrote testimonials, doctors, social workers that have helped work with patients, free online support groups, and just kind of a plethora of different things to help you get through this difficult period. So again, I'll leave this all with you to take home and to sort of look over. So there are a couple of other things to go over. So in addition to chemotherapy, radiation therapy uses targeted energy like that of an X-ray machine to destroy cancer cells. So this is just a picture of, this is one type of chemotherapy. This is a picture of a female that has breast cancer that's going through external beam radiation. And this targets it almost like an X-ray machine outside of the body, targets those bad cells. An internal beam is radioactive materials placed onto or near the tumor. And then systemic radiation is something you'll be swallowing radioactive substances. During this, you may experience skin changes, fatigue, nausea, or other unpleasant side effects. But clinicians from a variety of supportive care services will be there along the way to reduce side effects and improve the quality of life. I'm also going to leave you with some useful things for preparing for your first doctor's visit with your oncologist. Things to kind of keep in mind. Ask your doctor about side effects. Talk to your healthcare team about how you're feeling. Ask ways to manage your side effects, symptoms you may be concerned of. Also, tips for taking control. It's really important. You may want, especially on the first visit, you may want to bring someone with you. This is going to be a very difficult time, so it's good to have a great support system. Financial concerns you can talk to them about. Write down any questions you have prior. During the appointment, you may be very flustered, you may get a bit nervous. It's a lot to take in all at once. Make sure you write down every question that you have beforehand so you don't forget anything going in. One more thing, we did go over this before. While you have leukemia, your immune system is not working properly. So in the meantime, before you meet with your oncologist, just some things to know to keep yourself safe. Make sure to always keep great hygiene, keep clean, and try and stay away from people that may be infected, have a cold. Just try and stay away from them as much as possible because you are susceptible to a lot of diseases. I also printed this out. Just some things, some food for thought. 1 in 6 Americans get sick from foodborne illnesses each year. So again, you do have a compromised immune system. So just keep in mind, avoid raw or undercooked meat, unpasteurized milk, unwashed fresh fruit. So this just gives you an easy guide to what you should and should not be eating. So if you have any further questions, I'll leave all this information with you. Feel free to ask us or anyone here so we can help make this transition as easy as possible.